Hey everyone, thanks for joining me on the podcast. I'm your host, Jared Taylor. We have two special guests, one of which has been on the podcast before, Anna Lindow, and we brought someone on from Town Hall Ventures, Anna Fagin. I'll let them both introduce themselves. This is a first, by the way, on this podcast we have where we bring on both the founder and the investor. So we're going to get that dynamic going. So we'll start with since they're both named Anna, this is going to be interesting for me because we're not in the same room.
Another first.
Yeah, another first. And that was Anna Lindow. Why don't we kick off with you? And I don't want to say Anna 1 and Anna 2 because that kind of it means nothing. The number means nothing. It is not.
Anna F. You can throw in that.
Yeah. Let's just run with it. If you could each give a quick intro, we can kick things off.
Fantastic. Well, thanks so much for having us, Jared. I'm so happy to be back on the podcast today. I am Anna Lindow, the CEO and co-founder of Brave Health, which is the largest national virtual community mental health center and engagement platform. So we are really focused on delivering mental health services primarily to Medicaid beneficiaries. We operate in 18 states and we work with health plans and other partners across the country.
And I'm Anna Fagin. Great to be here. And honestly, it is a privilege to share the mic with Anna Lindow. So I'm an investor at Town Hall Ventures. We're a healthcare-focused fund dedicated to supporting entrepreneurs, purpose building for medically vulnerable and underserved communities. We think that the biggest opportunities in healthcare are going to be those that close critical access and health equity gaps in the country, and love to put sort of our full weight and support behind the companies that we think are doing just that.
And I was super excited to kind of see the pairing between you two, and what that means for the company. So, what I would love to kind of dive into, AL, first is talk us through the latest round, how much you raised, who else participated along with Town Hall Ventures, and then we'll dive into on the Town Hall Ventures side, what You gave a quick highlight of initial investment and why that made sense, but let's dive more into it. What did you really like about Brave, and maybe we can have your thought process on why you believe they're doing some great things. I know that, and obviously AL knows that, but I think everyone would really appreciate hearing an investor's perspective as well.
Excellent. So as you mentioned, Jared, we just recently announced that we closed a $40 million round just this past week, and Town Hall led the round, which we were thrilled about. We have been really fortunate to have investors with us from the beginning that have been so committed to Brave's journey and to what we're building and our vision and our mission. Union Square Ventures has been with us since the seed round. City Light Capital joined us shortly thereafter and has been with us along the way, and both participated in this latest round of funding as well, along with some other healthcare specialist funds, folks who focus on impact investing. So we feel really great about the people that we have around the table. And with Town Hall in particular, they bring such a deep, rich set of perspectives and just expertise across the board on how companies can best grow to serve the population, the very populations that we serve at Brave. So we felt that was such a unique aspect of how Town Hall focuses that it was a perfect match for us.
Love it. Congratulations. And Anna Fagin, we'd love to hear, again, first time ever on the same episode, your take on, what you really liked about Brave.
Yeah, absolutely. Well, I think first and foremost is my counterparty here on the podcast, which is we love supporting entrepreneurs who are as committed to the mission and to really improving people's lives as we are. And, Anna and I first met while we were literally walking her dog around Miami. And it was clear from that first conversation that she fits that bill in spades. But admittedly, that's not enough. That's not all we need to see. We need to see a really exciting business and investment opportunity alongside a highly mission aligned and be competent doesn't begin to probably cover what the scope of what Anna can achieve, but capable founder. And I think what stood out to us from the beginning around Brave is they're really that combination. They're uniquely committed to solving problems for a population that other people frankly shy away from, and they've done the hard work to actually build the infrastructure and the investment needed to really make a credible difference in people's lives and do so at scale. And that knowing that we in partnership can help take that scale and really bring it to more people and do so in a way that can create really meaningful, a really meaningful business along the way is a real privilege to get to be a part of that.
I was going to interrupt you when you were speaking. It doesn't take, I was going to say, it only takes being able to walk your dog well to raise capital, but I don't want to, throw people off. But then you said, but that's not all, and I didn't have to jump in after that. So that was good. What's funny is why I started like kind of these new shows with Under a Slice of Healthcare was for more transparency, right? So people know it's not just about I met someone it's those relationships help kind of kick off a spark. But I think a lot of people that aren't entrepreneurs, I think they don't fully understand that just because you build a connection and someone, it doesn't matter. Like it is important who you know, but that does not come into play with getting money from. You're not going to give someone that you met money like you want to see that they're going to build out a business that's impactful. And so super funny you said that. I just had to say it. And if I sound a little wild today, just for everyone and for all of you, I'm used to having insane amounts of caffeine, and I cut like not cold turkey, but like almost down to nothing. And I don't know what to do with my hands right now. So like you can't, I'm muting my mic. I'm hitting underneath the table. And that's why like I had this coffee here just a little bit to, keep me going in the interview. But what I want to do real quick, we'll go back to on the Brave side of things. Tell us what's next, excitement around the team, and then I'm going to try with both of you a new segment, which I think you'll like.
All right, cool. Well, so our team is really thrilled. Of course, it's always great to have the business capitalized in this way, but it's not just about the money, it's about the partnership, right? And so we're really excited to welcome Anna Fagin to our board, to welcome Andy Slavitt as an observer, and to be working with Town Hall in the way that we are. We're also really excited about the next chapter of what Brave holds, right? We've been working on Brave for several years now, and it's really been about proving out that a scale community mental health model is possible, leveraging the power of virtual care. But there's so much ahead of us. And when we think about what's next, it's not just growing what we're doing in our existing states, in planting flags in new states, but it's also in working with our industry partners, which is largely Medicaid managed care, right? We have fantastic health plan partners who are blazing trails on how to evolve what reimbursement can look like for specialists in this field. And we think that is just as critical for the next chapter of what mental health care can be in communities in our country, just as critical to how you deliver care in a sense is how it's reimbursed, right? Because that shapes the future in such an important way. So that's where we're going to spend a lot of time, and we're going to be focusing not just our time, but also our resources, right? And investing and continuing to support the value-based care arrangements we've been working on and to continue to build those out with our health plan partners as we've spoken about.
I'm super excited for you and the team.
Thank you so much.
We're going to try a new segment. And this might be the lack of coffee talking, but we're gonna do something goofy, but I think it's important for people to kind of to get another side of both of you as well. We're gonna go through just a list of fast questions around things that you like. All right, super goofy. This is separate from
Let's do it.
But let's do it. All right. So we'll go AL and then AF.
Okay.
When we're going through it. All right. Favorite dessert?
Oh, that's tough. All of them. Any dessert. Anything. Yeah. Chocolate.
I'm gonna go with cheesecake. I've been in a mood recently, and we're just gonna run with it.
Every day, I'm in a mood for cheesecake. I will tell you that. I love cheesecake. It's my favorite. That's my answer.
Good answer.
Favorite dog breed? Favorite dog breed?
Oh, mini dachshund, all the way.
Well, she's biased.
I'm very
earlier
biased.
conversation. My grandparents would kill me if I didn't say a golden retriever. But admittedly, I'm more of a people person, so I generally defer to spending time with people versus the animals.
Okay, we'll make sure to put your Town Hall Ventures title, not dog breeder. No,
being honest here, not gonna lie.
Yeah. No, I appreciate it. It's all honesty on this podcast. Love it. Favorite outdoor activity?
Well, I live in Miami, so we have a lot of opportunities for outdoor activities, which is great. But probably going for a walk on the beach.
That's a good answer. I live in New York City, so we have fewer immediately available outdoor opportunities. But my favorite place in the world is Thetford, Vermont, and there's this mountain, which is hardly a mountain, but it has a fire tower on the top, so you get basically amazing views for like the effort that you put in, because you get to climb stairs, not necessarily hike up a whole mountain. And so that is, if I had to pick one outdoor activity to do my whole life, that would be it.
And last question, if you weren't doing what you are today, what would you be doing?
Wow. I don't know. In my next life, I think I might become either maybe a clinical psychologist, or like maybe I would have gone down the practice route, or make my parents happy and become an opera singer.
Anna's answer is much more relevant to what she does today than mine is, admittedly. I would be doing something very different. I would probably like own a knitting store or something very sort of local and community oriented. If I went down a totally different path.
I think I'd go into law. I've always liked law. Although there is some boring parts to it, right? But by the way, that was a trick question specifically for both of you. When you pause, when people ask you that, it just tells everyone that you're doing what you were meant to be doing. Because if you thought of something like, "Oh, easy, this," you shouldn't have a backup plan that quickly, right?
That was my first thing. As I was going to say, I don't think it's hard to imagine not being this.
I think I have the coolest job in the world, truthfully. I get the privilege of working with people like Anna all day, and helping them sort of realize their visions. And it truly, I feel lucky to get to do this every day.
Love it. Great answers. Thank you both for coming on the podcast. This was a ton of fun. This is not going to be, everything else today will not be as fun as this. So this was this
and
was
good
great
luck
to
with
chat
the coffee adjustment.
Truly.
Yeah.
Thank you both. All right. Thank you everyone for joining us here today. Be well.